Well, it's lovely to meet you. I'm a yoga therapist as well, so I was really interested when I heard your interview on Guy McPherson's show and
Hmm.
some of the work that you're doing. And when Scott asked me to do this online recovery summit, I thought of you right away. And so I'm really glad that we could do this. Mm.
Well, it's a real honor to be here, and it's a real honor to be thought of. So thank you. I'm just thrilled that I would be someone that would come to mind for this event. So my name is Nicole Marcia, and I'm a yoga therapist. I live in Vancouver, BC. I specialize in working with trauma survivors, primarily trauma survivors who are moving through addiction and sometimes also have other mental health diagnoses like depression, anxiety. Yeah, so I do a lot of different things. I am a project coordinator and instructor at Langara College Continuing Studies in their yoga programs there. I work for a not-for-profit organization called Yoga Outreach. And at Yoga Outreach, what we do is we train and place volunteer yoga teachers into organizations that serve populations of folks that might not otherwise have access to yoga programming. So I help to train their teachers. We recently got a grant from the Department of Justice Canada to develop a 2-year pilot project looking into the efficacy of trauma-informed yoga as an adjunct treatment for justice-involved youth who are in recovery. So I'm a program director for that within that organization as well. I'm a yoga teacher at Onsite, which is the rehab arm of the Safe Injection site in Vancouver's downtown east side. I own my own business called Fine Balance Yoga. So I have a private practice at Fine Balance Yoga. I also run a yoga class in my community through my business. And I work training teachers and clinicians in trauma-informed yoga theory and techniques, both through my own business and through different yoga therapy schools.
That's wonderful. You do have a lot of hats.
Yes, well, I mean, I think that yoga teachers and yoga therapists have to know how to hustle.
That's true.
You know, we got to know how to generate it. So that's one thing I've learned how to do is how to generate.
Oh, that's wonderful. One of the things it sounds like too is that as things have been coming along that you're interested in, you're kind of going towards it, you're helping develop programs. How is it you originally got into working with trauma and addiction?
It was kind of an accident. Do you want the whole story?
Sure.
Okay. Um, so when I was in my very early 20s, I experienced a violent sexual assault.
Um,
And, you know, in the aftermath of that assault, became a very heavy drinker, a heavy drug user, a heavy cigarette smoker. I was engaged in a lot of risky sexual behavior. I was using a lot of food. I weighed almost 200 pounds. And, you know, I didn't have a lot of insight at that time into the connection between, you know, what I was doing with substances and you know the assault that I had experienced. The connection between the two wasn't clear. And then one day I was sitting on the couch a couple years after the assault, smoking a cigarette, of course, and of all things, watching Oprah Winfrey. And it gets worse. Madonna was on Oprah Winfrey, and she had just had her first kid, and she looked great, as Madonna does. And I said to myself, you know, I wonder what Madonna's doing. She looks great. And it turned out that she was practicing something called Ashtanga yoga. So, you know, today Vancouver is completely inundated by yoga studios, but back then it was difficult to find a group of people that were practicing that style of yoga. But I did manage to find a group. And of course, moving into that practice, I thought to myself, well, yoga will be easy. I'll look like Madonna and I won't have to quit smoking.
right.
Needless to say, things turned out a little bit differently. Um, so a couple of years into that practice, I started to notice some interesting shifts. I started to notice that I wasn't needing to be drunk in order to be around people. I started to notice that I wasn't experiencing these really extreme sort of mood swings that could only be managed through nicotine primarily. So
Mm-hmm.
what I noticed was that, my mood seemed to stabilize, my anxiety levels seemed to go down. And again, I didn't have much insight into the connection between the yoga and the shift in my life. But I knew that the yoga was playing a role somehow. So fast forward to 2008, I completed a master's degree in yoga therapy studies through Lesley University. And just as I was completing my thesis and, going into panic mode,
Mm-hmm. Mm-hmm.
as many people who finish a thesis do, I got a call from the then manager of a place called the Burnaby Center for Mental Health and Addictions, looking for a yoga therapist. So the Burnaby Center for Mental Health and Addictions is a 100-bed residential treatment facility for people with concurrent disorders. So that means they have both a mental health diagnosis and a substance use issue.
Right.
Usually more than one on each end, though, right? So usually polysubstance users and multiple mental health diagnoses. So pretty complex populations.
Right.
They come from all over the province of British Columbia. Some of them are there, voluntarily, and some of them are court mandated to be there. So needless to say, it's a very complex population of people to work with. And, when I became a yoga therapist, I thought I was going to have a really cozy private practice with like lots of candles lit and some soft music. And this was not what I had imagined. It was very institutional, and I was working with people who were, a lot of whom were very street entrenched, and many of whom had been actually institutionalized for most of their lives.
Okay.
And
With mental health issues.
yeah, and really just vacillated back and forth between the street and being active in their addiction and being in treatment or
Incarcerated.
yeah, basically.
Right.
So it was a bit of a shocker coming in. So I worked there for the first year and I was really winging it. And it was one of the things that made it very complex is that as a yoga therapist, I'm trained to work with people individually and create these sort of individual practices to meet the needs of my students wherever they're at. Or to run classes that are very specific, like yoga for low back pain. What was happening was I would be getting, 8, 10, 12 students in a room. One person on the mat may have a diagnosis of paranoid schizophrenia and they were struggling with an opiate addiction, right? And then I'd have another person on the mat who was struggling with, bipolar disorder and, were struggling with alcoholism as well. And so it was a very complex population of people to work with a lot of different needs. So the first year I was really winging it. And then a year into working there, my boss called me into her office and she said, "Have you ever heard of something called trauma sensitive yoga?" And so like a good yoga teacher, I lied and said yes. And she said, "Is that what you're doing with our clients?" And I said, "I think so, yeah."
Yeah.
And then of course I scurried off to my office and I got on the computer and I looked up trauma sensitive yoga. And I had the very, very good fortune of finding Dave Emerson out at the Trauma Center at the Justice Resource Institute in Brookline, Massachusetts.
Mm-hmm.
And I also had the very good fortune to be able to go out there and take a 40-hour training with him and subsequently have completed 300 hours of training with him and with that organization. And I now hold the title of a trauma center, trauma sensitive yoga facilitator. So that work was very important to me. And that initial training shifted things for me, both personally and professionally. So personally, what I got was that I had been using drugs and alcohol and food in order to regulate my nervous system, which had become dysregulated in the aftermath of the traumatic experience that I had had. And I
Right.
had been doing those things in order to be able to be in the world. What I got professionally was that it actually wasn't important for me to be designing practices that were going to meet the individual needs of every single person on each mat. What was important was for me to be, first of all, willing to hold space for people to move through whatever they needed to move through. And it can get a little funky sometimes, but there needed to be a willingness to step into that role. And also, a shift into realizing that what was most important for me was to be able to create safe spaces and safe practices that would address the trauma that was at the root of what most of my students were struggling with. And so that's how I got into this work. And again, I spent 9 years at the Burnaby Center for Mental Health and Addictions, as well as Riverview Hospital, which is a mental hospital here in Vancouver. I worked for the health authority in both of those spots, and it wasn't at all how I had imagined my career going, but I don't regret it for a minute. I mean, I love the work, and I have an affinity for the work and for the people that I work with, which in retrospect isn't a surprise.
Yeah, wonderful. There's two things that I'd like you to follow up on. One is creating a safe space. I mean, actually, it's creating a safe space, but then how is that for you personally? How is that for you personally? What do you do or not do to become that safe container for that work to happen? So I do that very similar kind of work with people. And I think people are quite interested in knowing, I mean, how does that work? And then in the group setting too. So how does that work for you personally, and how does it work for you when you're working with people?
Well, let me talk first about how it works for me when I'm working with people, like sort of the
Okay.
nuts and bolts of creating safe space. Is that
Mhm.
what you're referring to? Okay. So, it can start really with the physical space. It can be that simple. So being mindful of what's happening with lighting, choosing music that's very neutral if there's any music at all. So that means no chanting,
Mhm.
avoiding lighting candles. And then there's, language, which is a really big piece of creating safety. So avoiding Sanskrit, avoiding naming the different forms of yoga, calling them poses or calling them forms rather than poses.
Mhm.
And again, this is all about trauma sensitivity, right?
Mhm.
Um, and making sure that my students don't have their backs to the door if that's possible. Really focusing on the language of invitation and the language of inquiry rather than more directive language that you may find in less trauma-informed spaces. So
Mhm.
that means always inviting students to do something with their bodies and to notice whatever arises for them, as opposed to being in a more directed place where, I'm telling someone what to do with their bodies and telling them where I want them to feel it or where they should be feeling it. Because inherent in that language of invitation and inquiry is hopefully the expression of choice, right? Like you get to choose what you do with your body. It's an invitation, it's your choice.
Mhm.
And then, also this idea of inquiry, like you get to bring your curiosity to your experience. I don't know what it's like for you in this moment, but I want to support you in noticing what's there. And certainly the absence of physical assists. I don't try to touch or manipulate or move my students' bodies in any way, so they can sort of let down and not be on guard for that happening. Always letting students know where I am in the room, and what I'm doing and why I'm doing it. trying to make sure that there isn't someone directly behind anyone else. If I can set the room up in that way, if the space allows, that's important. Yeah, so those are some nuts and bolts of creating safe space. In terms of the way that I am within that space, I think that one of the most important pieces of creating safety is being clear about my scope of practice.
Mm-hmm.
And, you know, as yoga therapists, I mean, the International Association of Yoga Therapists has just put out some guidelines around that, but we've really been free agents, so to speak, with that. And so I sought out different governing bodies a long time ago and started researching them, like the College of Physiotherapists or that kind of thing, in order to try to adopt some ideas around scope of practice and ethics.
Mm-hmm.
Like, this is something I can support you in, and this is something I can't. And it's an ongoing journey, especially when I'm talking about working with people who are struggling with their mental health. So that's a big piece of creating safety. And in terms of also what I do with myself or for myself, or how I bring myself forward to my clients, empathy is really big. You know, empathy is huge, but also getting, like, I can be empathic and that person's experience isn't mine, you know, knowing that I can separate that. Being in therapy also helps, you know, me to create safety for my clients. I need to be able to debrief.
Right.
And of course, self-care. Yoga practice is a part of that. Eating well, connecting with people. Does that answer your question?
Mm-hmm. Yeah, it does. Yeah, thank you.
Yeah.
One of the things that I know about working with traumatized people is that sometimes, I would say almost all of the time, working with the breath is very calming and stabilizing. And
Mm-hmm.
sometimes they can't. It's
Mm-hmm.
the fight, flight, freeze is too extreme. And even working with the breath isn't quite safe. And
Mm-hmm.
certainly feeling all of the sensations and energies. And when we do yoga, they start to become more aware of what's in the body. How do you work directly with that fear, that feeling that I don't know if I can survive actually knowing what's going on down there?
Mm-hmm.
How do you work with that?
You know, I really try to let my clients and my students set the pace. You know, it's a very client-centered, strength-based approach that I take. I'm very, very clear that my students and my clients know what they need and know what's best for them.
Mhm.
So I bring a lot of curiosity and a very open space and an open mind to sessions. So a lot of inquiry on my part, like, um, and you know, also providing a lot of information, why we're doing what we're doing, and also highlighting that experience is subjective. So you may have this experience in this breathing technique, or you may not, but I want to invite you to join me in it and see what it feels like. Do you want to move forward with this?
Mhm.
You know, and they may say, I want to see you do it first, or no, I can't focus on my breath. No problem, no problem. But really trying to be as explicit as possible from the start. You know, you have choices in everything that we do.
Mhm.
Everything is an invitation. Here's how this might be helpful. Uh, Keep in mind that it might not, and that's okay too. And, you know, how would you like to move forward now? So things move slowly. Practices are incredibly simple, but that doesn't mean that they're not profound and effective.
Right.
You know, I remember I was working with a woman who had just experienced, like, the kind of childhood sexual abuse that when you hear about it, you just don't believe it. You know, it just is impossible to believe. And she's about my age, and we were working together, and we were both in a particular physical form of yoga. That's another thing that I do in order to create safety for my clients is that I actually move my body with theirs. I practice with them. We have what Dave Emerson at the Trauma Center calls a shared authentic experience. So we were both in the same form. And she looked up at me and she said, "Can I say something to you?" And I said, "Sure." And she said, "This is my body." And I said, "Yeah, you know what? It is. It is your body." And she said, "I don't think I've ever had that realization before."
Mm.
So that's profound, in terms of the kind of work that I'm doing and where I'm meeting people with the practice. Sometimes we're not starting at a place of self-regulation.
Right.
Sometimes we're starting at a place of, I have a body and it's mine. It doesn't belong to someone. It's mine. I get to say how it goes over here. Sometimes that's the starting point.
And that's a profound shift, especially if people have been experiencing abuse.
It is for
Right.
me. It
Yeah.
is for me, and it's not at all how I thought things would go. I had, especially in addictions, like I had fantasies when I first started that people were going to discover yoga and float off into the sunset. Uh, but what I saw as being recovery or success really, really shifted once I got down into the work and started recognizing the work that there was to do in terms of healing trauma.
It seems to be becoming a lot better known in the last several years that trauma is at the root of a lot of addiction and that we have to work in the body to work with trauma.
Yeah, I mean, it was really not talked about at all when I first started. I just was seeing my clients in particular at the Burnaby Center, and I was like, there's something else going on here. I mean, certainly there are the ravages of addiction that must be addressed in healing.
Mm-hmm.
But what I kept hearing over and over again was the story underneath it. And it was like, it seemed to me that that's what needed to be addressed. That's what needed first, somehow, to be addressed. And
Right.
what's great about yoga is that it meets people in both places, right? It meets people at the underlying trauma, and then it also meets them at the level of, this is what addiction has done to my body and my
There's a
life.
reality check there.
Yeah.
Yeah. So when you're working with people
Mm.
and people are starting to get some feeling in their body, they're starting to kind of inhabit their body in a different way, perhaps. The way I've been working with people is very much that there seems to be a tipping point where people kind of get it in their cells that it's okay for them to be in their body.
Mm.
Before that, there's just too much fear that we're not familiar with it, and because of the stored trauma,
Mm.
um, a lot of the times there's memories and images that are coming up during a yoga practice or during when we're paying attention to energy in the body, a lot of stuff gets stirred up, which in
Mm.
a way is good because then it can be released and seen.
Mm.
So do you have that happen in the class as much, or how do you work with that with people, or is it part of kind of the structure of what you're doing? It's just kind of built in.
How do I work with release, like trauma release? Is that what you're
Well,
asking?
both that and also just the fear that maybe that's not going to be okay if trauma starts to release.
I normalize it. So one of the things that I would say sometimes at the beginning of a class is, I just want to say that it's normal for emotions to come up when we're practicing because trauma gets stored in our bodies. And when we're doing this kind of work, it can release. it can come out. And this is, I endeavor to have this be a safe place for that to happen. So I might, normalize it in that way. And yeah, probably the same in my private practice. I mean, I really encourage that.
Mm-hmm.
I really normalize it. I sit with people if I need to sit with people. So I was working for a research study that was happening. It was a partnership between the University of British Columbia and the Mood Disorders Association of BC. And they were doing a research study into exercise as medicine. Very, very interesting work. And I was teaching the yoga piece. And, there was a gentleman in there who started having a lot of release, a lot of trauma release, physical release, and a lot of sort of jerking and convulsing. He'd never had the experience before. And he couldn't control it. And, he was conscious and aware that something was happening, but couldn't manage it. And I brought the class down. It was sort of close to the end. I brought the class down into a stillness practice, which is what I call Shavasana.
Mm-hmm.
And then I just went and sat with him and said, talked a little bit about what he was going through, normalized what he was experiencing, and sat with him till well after the class, brought the students out of the practice. They went home. And of course, the students hold the space for each other. That's the best piece. Like, I'm doing a little bit of extra, but they create that space for one another, and that's where healing takes place. It takes place in relationship to other people, as Judith Herman says, right? If we follow, Judith Herman's work and consider this idea that one of the things that gets destroyed in the midst of traumatic experience is an experience of safety, and in particular safety within the context of relationships, and that healing has to begin with the establishment of physical and social safety, then yoga class is really a perfect place for that to have happen.
True.
So there was the relationship between me and that student, addressing and normalizing what he was moving through. And then there was the beautiful space that the students held, the beautiful, loving space that the students held for him, giving him his privacy, giving him warmth and support, and, exiting so that he could move through what he needed to move through. Mm-hmm. So I guess that normalization is probably the one-word answer to that question. It's just like, that's good, it's normal, let's bring it forward.
I think people feel a lot of relief when they realize that it's normal. It's nothing that they're doing wrong or anything. It's just, this is how it works. This is how the nervous system works. This is how energy works. It's just how it works.
I've got folks who hold it together in very stressful jobs, raise families, are accomplished athletes all at the same time, way more high functioning than I am. Yeah. And they'll come in for a session and they want to do a little bit of yoga in order to come to that place where there's release. Mm-hmm. They want to release. And then a lot of the time, Lynn, they want to rest. Because it's the only time in the week where they can move through that process. And they won't do it alone. Sitting down in the basement watching TV, eating Cheetos. It's not going to happen, right? It's got to, somebody has to bear witness and hold safe space for that to happen.
Exactly.
Yeah.
And sometimes, even people who know very well how to rest, it doesn't feel quite safe enough unless there's someone else there. So that's such an important function that the people in the class hold, but in particular, the person who's holding the container.
Yeah.
Then they can really kind of let go.
Yeah.
Yeah.
I think so. It's I think it feels nurturing too. And certainly a lot of the people that I work with were missing, nurturing. in their lives, like someone who you can be vulnerable in the space of.
Do you work directly with shaming, self-negative talk, that kind of thing as well? Do you work directly with thoughts, or is it more yoga through the body and the energy?
Well, I'm a little bit more comfortable focusing on body-based techniques,
Hmm.
uh, just because I am very aware of my scope of practice and what I'm most skilled at. So what I might say is something like, I hear you saying that about yourself. I'm sort of curious when you say that, where do you feel it in your body?
Hmm.
And is there a kind of movement that you'd like to explore connected to that experience or connected to that place in your body? Or if you could move your body in any way in this moment, how would you move? So again, it doesn't always look like yoga. I had a client, I asked her that we were practicing and she started to get dysregulated. And and she was saying some things about herself, like what you're talking about, like some pretty derogatory things about herself because she was getting triggered while she was practicing.
Right.
And I said, if you could move your body in any way in this moment, how would you do that? And she said, I'd run out of the building. And I said, do you know that it's okay for you to do that? If you want to walk out the door and you want to run down the block, that it's really okay to do that anytime you want, and that it's also okay for you to come back. And, she just broke down and started sobbing. It was important to her to know that she could take effective action in the face of remembering traumatic experience.
Right.
Uh, so usually I'm looking for the connection between the negative belief and the experience that arises in the body.
Right.
Then, looking to the client to discharge that or meet that in some way. Yeah.
Bringing addiction specifically into it. So most people with addiction, do you see that most people with addiction have a traumatic history of some kind? Do you see people with addiction that haven't been traumatized as children or early in their life?
You know, they may not have childhood trauma at the root of their addiction, although nobody comes to mind, to be honest. But then what you may see is trauma that occurs as a result of being active in one's addiction. So again, I work with people who may be involved in the sex trade,
Hmm.
or who are underhoused or street entrenched.
Right.
Um, I mean, you name it, have been assaulted, arrested. Um, so, there's different layers of it. And then, I think it's also important to remember an additional layer um, underneath childhood trauma, which is intergenerational trauma. And, intergenerational trauma that's rooted in colonialism and, the aftermath of that.
Right.
So trauma is universal. And it arises in a lot of different stages and in a lot of different ways for people. And, a lot of pain, a strong drug. And drugs and alcohol are, in the short term, very effective ways for managing pain. But, the more you use, the more you need. And once you get into addiction, then you got a whole new set of problems. Big
Right. Big problems. Yeah.
problems.
Do you work specifically with addiction, or is it more you're working at the root of it with the trauma and the body and the yoga and the energy, and then that's what helps to, I'm not going to say cure the addiction, but it helps what people go into recovery from addiction? Or do you work directly, or are there certain things that you do for certain kinds of addictions like opioids or something like that?
Mm. I don't get real substance specific.
Hmm.
Uh, and usually when I'm working with addicts, I'm working with self-regulation, using the body as a resource for self-regulation, because, like I said, in my own experience, if I use that as a place to work from, we use substances to regulate. So one of the things I'll really focus on is how can we use yoga to regulate rather than substances.
Right.
Certainly, if people are ready, if that's where they're at, mindfulness practices, which I think can help to interrupt um, or can help to support impulse control and interrupt impulsivity or compulsive sort of behaviors. Not everybody that I work with is ready to move into sort of formal mindfulness practices like watching one's breath, but that's where the inquiry part of the yoga practice comes in, right? So this idea of, I invite you to inhale and raise your arm up and notice how this feels. That noticing, that inquiry point, that's a kind of mindfulness. So that seems to be helpful, and that's another way that I work with people. And I got to be honest, I think that one of the main ways that I work with addiction and I work with trauma is through relationship. I support people in having a safe experience of being in their bodies with the hopes that they can start to have a feeling of being safe in relationship with me, in the hopes that they can go out into the world and feel safe in relationships out in the world, like those relationships that really matter. But I know, and I've learned through the great teachers that I've had, opportunities to work with, and Bessel van der Kolk in particular, talks about this. Like, if you don't feel safe in your body, you can't feel safe in the world. So I see one of my primary jobs in this work as actually being someone who breaks isolation. I'm sort of a touchstone for that. The yoga is great. It's a vehicle and it's very effective. But I actually, the more I'm in this work, I see my role as that of being someone who breaks the cycle of isolation so that people can feel safer in their bodies and safer out in their relationships in the world. Because that's what it's all about.
It is. And a lot of times people haven't really experienced safety in any relationships, or nurturing, or being cared about or held, or yeah.
Or, just being around somebody who has safe boundaries, and knows how to express them and takes responsibility for when they mess up, or, everything can be an opportunity to model something or to bring someone into a safe experience of being in relationship. And that is one of the primary ways that we regulate, is by, through one another, that symbiotic regulation. If I feel safe around you, I send you cues back that you're safe around me. And
Right.
then do that back and forth. That's how we're wired.
Hmm.
And when you're down on the street and you're active in your addiction, or you're homeless, or you're in survival, that's not what's happening. Those aren't the signals you're sending people, and it's not the signals you're getting back.
And then that becomes very much just the way we operate. We don't, even if we are alone, even if we are safe, even if we're with someone who's safe, it doesn't let go very quickly. It can take quite a while of experiencing little bits of safety, a little bit more, a little bit more. And then it kind of starts to sink in that we don't have to defend ourselves in that way in this environment and with this person.
Yeah, and I'm one of those people, hopefully, for this client that's coming to see me. I'm not the
Right.
only person, I hope. I'm always encouraging my clients and my students to be in psychotherapy, in recovery groups, seeing, registered massage therapists, like joining groups, get out in the community. Like I can be one person, but like, let's create a community around this person. Like we all need community.
We do.
And especially when we're struggling, because like I said, nothing good happens in isolation.
Mm-hmm. Yeah, that's so important. The isolation piece, and what they know now about the nervous system and how social groups function is that it's a survival level threat if we're isolated and if we're shunned or ostracized in particular. And there's so much shame around addiction and so much shame around trauma.
Huge amounts of stigma. And definitely around addiction. Huge. Yeah, you're absolutely right. And that's certainly one of the barriers to getting help, is that stigma. Yeah.
It's interesting to look at different countries in the world too and see how, like, Portugal is having a very different experience since they stopped the war on drugs and they
Mm-hmm.
decriminalized personal use opioids.
Mm.
And so now if someone gets busted for using, they're sent to treatment, not to jail.
Yeah.
Completely transformed their whole experience with it. And I really hope that, one of the benefits of this really drastic opioid crisis that we have right now will be that maybe people will start to look at, well, we're obviously doing something wrong. This war on drugs isn't working. What are we going to do? How are we going to actually stop this? It's horrible what's happening.
It is. It's inhumane.
It is inhumane. Yeah.
And you can see it. I don't know if you know much about what's going on in Vancouver. So there's a huge fentanyl crisis here, and it's like it's not only impacting, of course, the people who are sort of street entrenched and really active in their addictions, but also like people across all socioeconomic spheres, all ages. And so this idea that the stigma around addiction, that somehow it's just like them over there, is really getting broken down, and a light's really getting shone on how few services there are for people who use, regardless of where they land in society.
So I wanted to ask, if you were talking with somebody who has an addiction problem, and they're looking to get into recovery. Number one, how do you define recovery? And also, what would be some steps that you feel are really important for someone who is just starting on the path of recovery?
Well, I really, at this point in my career, and given the people who I've spent a lot of time with who are struggling with addiction, I define recovery primarily as harm reduction. So for me, that means making sure that someone is surrounded with community. So first of all, there needs to be safe housing. There needs to be access to food, medicine, and either, safe, affordable access to, alcohol or drugs, or, something like methadone.
Mm-hmm.
To me, recovery means being back in touch with your community, if you had a community at some point that wasn't using, or reestablishing a new community that you can share common interests with, and explore activities, or touch in with people who call you, setting up social supports, right? Uh, Getting proper medical and psychological care, getting access to community centers and exercise, like physical activity, yoga, all of those things. I mean, I see recovery and healing from addiction as making sure that people have access to the supports and the services that all human beings need in order to feel healthy and safe in the world. And we're all different.
Right.
And that's justice, right? Like, we're not talking about equality, we're talking about justice. What I need in order to feel safe in the world is going to be different than, say, what you need or what the guy down the street needs.
Mm-hmm.
And it's about really being met where you're at with the services that focus on your strengths and your interests, and also services that are really chosen by the person. Like, I really want yoga to be a part of my recovery, or I really want swimming to be a part of my recovery, and I'm really interested in 12-step programs, but I don't know how to get into one. Or and the other thing is like really easy access to drug and alcohol counseling and detox and treatment centers. It's not rocket science. And
Right.
decriminalization. I really agree with decriminalization as well for personal use. And, um, giving people test kits so they can find out how, if there's any fentanyl in the drugs that they're using, having safe injection sites. All of these things are pieces of recovery / harm reduction. But if none of these things are in place, there's no hope.
Right.
I think there was a second part of your question, but I can't remember what it was. Like, what would I tell someone?
Well, and I think you actually covered it in terms of talking about what's involved in recovery. So all of the different elements you reached out, you talked about community and making it your own, and what really to have a look at what would recovery look like for me,
Yeah.
and to do that.
Yeah. I mean, I think it would be very interesting if all of those things were in place and, see what happens. But I don't at this point equate recovery with abstinence.
Right.
I
Right.
used to.
Mm-hmm.
I used to, but I don't anymore.
Mm-hmm. And so how does it work with the mental health issues and the addiction and the trauma? Is is it basically the same approach that you take? Or I mean, there's drugs, people are taking medically prescribed drugs as well, right? And
Mhm.
some of those people are really tired, they can't stay awake, there's stuff going on in their bodies. That must add another layer of complexity to it.
Yeah. And then you get a whole group of them.
Yeah.
Then it gets complicated. Yeah. And so again, my solution has been to simplify. What do I need to do here? I need to create a safe space. There are a lot of different aspects to that. A big one is empathy and acceptance and a good sense of humor. Those are some big ones.
Yeah. Yeah.
Um, and I need to be bringing forward, offering, inviting people to engage in practices that may address some of the dysregulation that's at the root of their struggles, and that's a result of the trauma that they've experienced. And they may have a diagnosis of bipolar disorder, and they may be on, methadone for an opiate addiction, and, drugs for insomnia, and all different kinds of things that are having lots of different side effects. So really the only thing that I can do is show up, have faith that my presence makes a difference, and hold space for people and invite them to engage in as much or as little as they want. Have it be okay if they want to go. Have it be okay for them to come back. Have it be okay for them to ask questions in the middle of practice.
Mm-hmm.
Have it be okay for them to fall asleep if that's what they need to do. Have it be okay for them to wear their shoes or show up in jeans, or have a cup of coffee sitting next to them, or step outside and have a cigarette and then come back to the class. Yeah, I mean, I have some boundaries with stuff, but
Mm-hmm.
you're just trying to create a safe space for somebody to land in, especially in these institutionalized settings.
Yeah, there's not a lot of personal choice and agency just in daily life in those places.
No, and there can be a lot of drama and violence and a
Right.
lot of interpersonal discord. And then you've got, of course, the dealers coming up onto the property on welfare day, on check day. you know, it's just, there's like, there's no safe space. So certainly one of my roles in those kinds of settings is to create a space like you can come here, you can relax if that's what you want to do, you can move your body if that's what you want to do, maybe we'll talk a little bit, you know, just bring some normalcy and some humanity to a pretty chaotic life.
Well, thank you so much for the time, and what you've been saying is just fascinating.
Oh, good.
Yeah.
Well, I'm glad. You're very, very easy to speak with. And again, it's just an honor to be able to contribute to what you're doing here.
Oh,
Really.
thank you. Yeah. You know, the Kiloby Center is a mindfulness-based
Mhm,
recovery center,
mhm,
and they do yoga there, and they do a lot of work in the body, a lot of energetic work. And
mhm,
so when Scott Kiloby wanted to have the summit, the idea partly was to really look at around and go, who's doing what in the field of recovery
mhm,
and what really makes a difference. And, you know, 30-day treatment center, that kind of program that's been around for 40 years doesn't have a very good result.
mhm.
And it doesn't really, these things take time, and it takes a lot more resources than what we have going into it right now. And some of the community aspects can be free, really, but there needs to be a certain structure that kind of encourages that and helps people to find a way in. And yeah.
Yeah. And, you know, it's just about redirecting resources. You know, I mean, it's basically about a shift in um, perspective and just acknowledging, I think, first of all, that all of these factors, you know, primarily starting at like childhood trauma, if you like, contribute to these huge costs for society.
Hmm.
And, you know, rather than throwing money at the aftermath, why not, you know, give families supportive, safe places to live, you know, with access to counseling and, you know, and just sort of build from the bottom up. But instead, we try to approach things from the top down, and it fails because it doesn't really get to the source
Right.
of what's happening.
Hmm. Well, and the human costs, the social costs are devastating. And so it's really wonderful to see that there are some programs like what you're doing, and that you're doing it in an institutional setting. It's a
Mm-hmm.
really good sign. You know, it's not just talk therapy anymore. It's not just 12-step groups. There's actually other other supports that are happening too. So that's wonderful.
Yeah, and hopefully at some point, you know, you know, I would, you know, I love the idea of yoga really being included as part of an interdisciplinary team, you know, across the medical field. I
Right.
think we have a lot to offer, you know, and yoga therapists are highly, highly trained
Hmm.
professionals now.
Right.
Um, so I think there's a big role for us to play. Certainly, there's more happening in the United States than there is here in Canada in terms of there being like sort of full-time positions in healthcare. But I think it's changing. The landscape's definitely changing. The quote that I chose was from Judith Herman.
Hmm.
Um, and the quote is, recovery can take place only within the context of relationships. It cannot occur in isolation. So, as I said, you know, in the interview, uh, really where I'm at in my work these days is seeing myself as a mechanism for breaking isolation and um, a person who people may have an opportunity to create a safe relationship with. That's where I see the work that I'm doing moving into. That makes sense?
Yeah, it does. Yeah.
Yeah.
Yeah. Thank you. It's kind of
Thanks.
the base of what it is that you're doing is that
Yeah.
breaking isolation. Yeah.
Yeah. And I just see it more and more. It's very interesting because I conduct trainings for clinicians and teachers. And, everybody's very interested in techniques, and I've got techniques, I've got techniques and I've got theories, and I can bring that forward, and I do bring that forward. But, I'm always sort of interweaving like the importance of relationship. Like, you've got to be willing to be related to people if you want to do this work.
Yeah.
If you think that you're going to hide behind a whole bunch of techniques and you're not willing to take the risk to be shifted by stepping into an empathic place with people, then you might not get a lot of people knocking on your door. You may not get a lot of success. But if you're willing to wade into that water.
And a lot of that then, of course, has to do with our own personal recovery. If we can do our own work, then we're going to be able to meet someone else. And if we haven't done our own work, it's going to scare us.
Exactly. And again, that's key. Like, you can't have safe space for other people and not be managing your own safety.
Yeah, yeah, absolutely.
For sure. And you notice it when your self-care is out, right?
Yeah, yeah, you
You're
do.
not getting enough sleep, or you skip the appointment with your therapist, or whatever it
Mhm.
is.
Yeah, you sure do. Yeah. Yeah, it's really fascinating. Um, this whole field, I don't really think about it as a field so much, but just working with people, especially people who are traumatized. And
Mm.
it seems like once you have that ability to be present with someone who's traumatized, then it just kind of, for me too, it's just kind of, that's almost exclusively I work with people who are traumatized because I can, I guess, and people feel safe with me. And and it just starts to kind of gather momentum.
Yeah, a lot of what gets destroyed in the midst of traumatic experience has to get healed in that place between you and your client.
Yeah. Yeah, it sure does. Yeah. Well,
Yeah.
cool. Well, that's good.
Yeah.
Well, thank you. It was lovely to meet you, and thank you very much.
Thanks, Lynn.
You can reach Nicole Marcia at finebalanceyoga.ca. She works in the Vancouver, Canada area, travels for workshops, training teachers and professionals in trauma-informed yoga. If you live in the Vancouver area, you can reach her for her many classes there. Go to kilobyscenter.com, Radical Recovery Summit, to see the full schedule of speakers and to register to watch these free online September 23rd and 24th in the Radical Recovery Summit 2017.